At Mattson, we started looking and doing a deep dive into GLP-1 users over 2 years ago. At that point, no one in the food industry was really calling us, so we leaned in. We did our own research with consumers, both qualitative, quantitative, also with some of our AI models. We learned a lot. What was interesting, even in the next year or so, we thought on the packaged goods side there was a really slow roll in terms of products coming to market, either new brands or even just GLP-1 badging. I think that's really started to change. When we think about restaurant and food service, that aspect of the food industry I think is even further behind. There's a few notable examples where we've seen GLP-1 menu items and some very specific products being delivered for consumers, but if anything, they're even further behind. So it's interesting to us that just given the scale and the size of the opportunity, that the food industry is taking some time to react, but now it's certainly waking up and moving quickly. Yeah, I really believe that there's opportunities for the food industry throughout the GLP-1 consumer's journey. So certainly in that rapid weight loss phase, consumers need support, micronutrient, macronutrient support. You hear about lean body mass loss. You hear also about just nutritional needs because they're simply eating fewer calories. However, I think the longer term and potentially bigger opportunity is thinking, hey, once consumers get to their goals and are in this sustaining mode and may have this natural tension to either want to wean themselves off the drug, either for cost or other reasons, how might we continue to support them in that kind of maintenance journey? And I think that's really looking forward. Right now as a population, there's so much activity in the front end of this curve where there's a lot of weight loss reduction and early maintenance. I think that's where there's this potential bigger opportunity for support.
We're seeing a couple of different angles at this conference as well, with companies either using things like fibers or other things that might stimulate the body to naturally produce more GLP-1. We're also seeing a new wave of companies producing so-called biomimetics, things like engineered microbes with peptides that will activate GLP-1 receptors and so on. How do you see those kinds of products fitting into this marketplace?
I think that they definitely are interesting. GLP-1 receptor agonists, mimic hormonal systems. I think that's part of the reason they're so effective because they work really broadly across body systems. Yes. I think there's the natural component that can be stimulated potentially by food or supplements. And I think to me it's an unknown. The answer to your question is a little bit unknown. I think certainly the pharmacological doses that are often delivered at thousands of times the natural occurring may be required for the weight loss that we're seeing in consumers. However, once they do get into that long-term maintenance phase, then I think there could be potentially more of a role for foods and beverages that specifically work and stimulate in that space, because it becomes an and. There's going to be this tension where consumers may not want to remain on the highest level of the drug, and so they may seek to roll off. They might experiment with microdosing. And I think in those phases, those long-term phases, is an enhanced role for what you're talking about, which is foods and beverages that stimulate that natural. But again, I don't think the answer right now is really known. I don't think it's going to necessarily be the silver bullet for achieving the weight loss results that you're seeing on the medications, but it may have it may fit in another point in the consumer's journey. I think the communication is a huge part of this, in part because the patients themselves don't necessarily have a lot of information. The primary care physicians or maybe an endocrinologist, if they're lucky, know a little bit about how the drugs work, can advise them, don't know often much about food and beverage or nutrition. So that's where I do think that the communication is really key. So thinking about the hierarchy of benefits, how this fits into a consumer's life, how might it support them, I think is really important. So, there's a lot of products out there that already probably check the box on a lot of what, would be a good GLP-1 companion product. Protein, fiber, macronutrients, portion size. A lot of times, interestingly enough, these are the same types of attributes that would be good for all of us. But figuring out how to, in a more nuanced way, to communicate to consumers is important. And answering those questions around, hey, do I create a brand new brand? Do I create a sub brand? Do I create a GLP-1 friendly badging? And since that's not regulated by anyone, well, what does that mean? And so if consumers see this front of pack communication, or what you might see when you're scrolling through social media, how do you make those messages really instantly understandable, but also robust enough so it's not just leading consumers in the wrong direction.
You've recently conducted some consumer research. Were there any kind of interesting surprises that came out of that?
For us, what's interesting, and we've done a lot of research with consumers, both quantitative surveys and qualitative interviews, this whole area of people's perceptions of food shifting. So they talk about a reduction in food noise, which is kind of turning down the volume on some of the cravings and some of the kind of the involvement and preoccupation with food. But I think even more interesting is we'll hear consumers talk about some of their preferences and tastes shifting. So things that they love, certain food products or experiences, they just aren't as motivated anymore, and they're finding within other food categories sometimes the types of delightful experiences that they once were met by another food type. So we don't really know it. Some of the research presented here I think is great from a starting point. It seems like depending on the patient there's some variability in terms of their individual preference shifts. What we're really interested to see if there are some themes that develop, especially if we get to a steady state where there's this 25% or more of the population that are on these medications. We'd really like to understand that, because when it gets to food product design, we want to meet consumers where they are, and if their tastes as a population are shifting, certainly that presents opportunities and would be something that we want to better understand. So more to unpack.